the pleura. So in this we discuss the competency, blood supply, lymphatic drainage, nerve supply, a pleura, extend the pleura and describe pleural recesses and their blood anatomy. Pulmonary cavities contain lungs and the pleural membranes. Pleural membranes are continuous serous membranes that form a closed pleural cavity within each cavity. The pleura in contact with the lung, is the visceral pleura. Outer layer, which is in contact with the inner wall of the thorax and the mediastinum, is the parietal pleura. Pleural cavity. Space within the pleural sac is the pleural cavity. Pleural cavity contains only a small amount of serous fluid and has no functional open space. It is a potential space. A real space can be created if outside material such as blood, pathogenic fluids or air are introduced into this space. Parts of parietal pleura. Parietal pleura is divided into specific parts based on the parts of the thorax it contacts. One is costal pleura that overlies the ribs and intercostal spaces. Then we have mediastinal and diaphragmatic pleura, which are in contact with these structures, that is mediastinum and diaphragm. Then we have cervical pleura that extends over the copula of the lung, above the first rib into the root of neck. The cervical pleura is strengthened by suprapleural membrane, an extension of the endothoracic fascia over the copula of the lung. Pleural reflection. Lines of pleural reflection are the locations along which the parietal pleura transitions from one region to the next. Sternal line of reflection is the point at which the costal pleura transitions to mediastinal pleura on the anterior side of thorax. Costal line of pleural reflection lies along the origin of the diaphragm at which the costal pleura transitions to diaphragmatic pleura. Then vertebral line of pleural reflection lies along the line at which the costal pleura becomes the mediastinal pleura posteriorly. Pulmonary ligament. Parietal pleura reflects onto the lung to become visceral pleura at the root of lung. A line of reflection descends from the root of lung, much like a sleeve of a loose rope that hangs from the forearm, forming the pulmonary ligament. Visceral pleura covers the entire surface of each lung, including the surface of the fissures. On the surface of the lung, visceral pleura are in contact with the parietal pleura. Pleural cavity is the space inside the pleural membrane. It is the potential space that under normal conditions contains only a small amount of serous fluid. It lubricates the movement of visceral pleura against the parietal pleura during inspiration. Pleural recesses. During expiration, lungs do not entirely fill the most of the inferior aspect of the pulmonary cavity. This creates a region along the costal line of reflection in which diaphragmatic and costal pleura come into contact with each other and no intervening lung tissue. This space is the costodiaphragmatic recess. Similarly, along the sternal line of reflection in which the costal pleura and the mediastinal pleura come in contact with each other with no intervening lung tissue. This space is the costomediastinal recess. Blood supply to the pleura. Visceral pleura is supplied by the branches of the bronchial and pulmonary arterial systems. Parietal pleura are supplied by arteries of the structures they cover. Cervical pleura by intercostal vessels, costal pleura by intercostal vessels, diaphragmatic pleura outer portion by intercostal vessels, inner part by pericardiophrenatic vessels, mediastinal pleura it is by pericardiophrenatic vessels. Lymphatic drainage. Visceral pleura is drained by pulmonary plexus located in interlobar and peribronchial spaces. Costal, mediastinal and cervical pleura drain into internal thoracic chain anteriorly, intercostal chain posteriorly. Diaphragmatic pleura drains into retrosternal, mediastinal and sometimes to celiac lymph nodes. Thank you.